Hello and welcome back to Laser 360 Clinic. We are continuing our conversation with Dr. Neeraj Goyal, who is a laparoscopic laser and general surgeon at Max Hospital, Patparganj. So last time we had a discussion with you about treatment options for fistula, and you very briefly described about laser treatments. So we would like to know from you in detail what exactly is laser fistula treatment.
So laser fistula treatment is where, as compared to the open surgery, the conventional fistulectomy, where the mandatory requirement is where that we remove all the tract and with that the surrounding tissue. So a large raw wound is created. As compared to this, in laser, we only need to fulgurate the tract. Fulgurate means we just make the tract dry. We apply the laser energy inside the tract so that the tract completely shrinks and closes. So if you can imagine how big advantageous this laser technology is, that we introduce the fiber inside the tract from the opening where it is discharging fluid through the skin, and from that point when we introduce the fiber inside and gently withdraw the fiber delivering the energy, within a few weeks time it completely shrinks and collapses. So this is how in principle we treat with laser a fistula. So if you compare open surgery with laser surgery, we are only drying up the tract with the laser energy. We don't need to remove the tract. Second part, as part of the procedure of laser fistula surgery, is that we make a very small incision, hardly 5-6 millimeter long incision near the internal opening towards the anal canal on the anal verge, and through that only we dissect out, we hook out the tract and we divide it after ligating with threads. So we completely ligate the tract, we completely close it, and then we divide it, meaning this rest of the tract is separated from that internal opening. This step gives us better results as far as recurrence of the fistula after any procedure is concerned. So in this manner, we just separate the internal opening and we close the tract by the laser energy by introducing the fiber inside the tract of the fistula. It takes hardly 15-20 minutes. The biggest thing is we didn't need to make a long incision, we didn't need to remove any tissue in laser fistula surgery.
Okay, sir. What do you think are the advantages of laser fistula surgery compared to previous methods which were being used?
Right. So as you can make out by understanding both the procedures, in open surgery we are requiring a large raw area. The bleeding will be more, pain to the patients will be much more. The duration of healing and discomfort during that period will be much more. Requirement of medicines is more. Requirement for remaining away from the routine and from office is much longer. And another big disadvantage of the open surgery is possibility of injury to the sphincter of anal canal. So in laser surgery, we are not having any possibility of injury to the sphincter. So 0% chance of anal incontinence in laser surgery. Whereas in open surgery, whatever may be the percentage, but yes, anal incontinence may occur in few patients, and that is a very serious concern. If anal incontinence occurs, it's very difficult to treat for the patient. So that is one. Second, all other disadvantages of open surgery are not there in laser surgery. Early return to work, very, you can say, minimal pain, so requirement of medicines is less. So symptomatically the patient feels as if nothing has been done, or hardly 5 to 10% of pain as compared to open surgery. Lesser hospital stay. In this manner you can understand laser surgery for fistula is a huge jump the way we used to operate or we used to treat a case of fistula in anal.
Okay, sir. In general as well, we would like to know that how is your experience of treating patients with laser in the field of proctology? What do you think are major advantages and takeaways from here?
Yes. So when the patient of fistula comes for the treatment, mainly there are about 3 or 4 concerns in the mind of the patient. One is that what will happen, how will that raw area heal, because he has heard the most about the open surgery. So as soon as we have a laser in our hand, we have the option of laser, we tell them don't worry, that raw area is not there, so you will be almost painless for this period. So he becomes very comfortable. So laser proctology has revolutionized proctology overall. So is for fistula, hemorrhoids as well. Second, the possibility, the potential complications in addition to this raw area were loss of control over defecation, that is anal incontinence due to sphincter injury. So I already told you, no patient of laser surgery needs to worry about this complication, whereas in open surgery certainly some patient may experience it to a larger or a lesser extent. So no risk of anal incontinence or loss of control over their anal defecation, their stool will not leak after the surgery. Huge advantage with laser. Third, recurrence, whether the fistula can recur again or not. I will say there is no such technique till date which will say 100% recurrence is avoided. So there is no technique till date which is foolproof as far as fistula is concerned. But here also the rate of recurrence with a very good laser technique of performing the procedure is about 5 to 7% cases. In open surgery also the recurrence rate is about 10 to 30% cases. In different surgeons' hands, in different cases, different patient, depending on so many factors, the recurrence always varies. But now, if I say for hypothetical purposes, if I assume that even recurrence rate is same in both open and laser, still in laser we didn't remove any tissue, so there is no scar, there is no fibrosis, there is no deformity. Whereas in open surgery, one surgery is done and there is a large scar, deformity is there. If recurrence happens after open surgery, that scar tissue is not a normal tissue. When we operate again, it becomes even more difficult or challenging for the healing to happen, and chances of recurrence because of the scar also increase. So even if a recurrence happens, laser surgery can be done again without having any kind of residual effect due to the previous surgery. So this is where there is no confusion if we have to make a choice between open surgery and laser surgery for fistula. That is all I would like to say.
Thank you very much, sir, for your kind words. Thank you very much for your time.
Thank you so much.
Have a great day.